Hey everybody, it's Dr. Strong and just wanted to make a video. And I have a lot of people that come into my clinic and they're like, what is functional medicine? Like, what is that? I've never heard that before. And I wanted to do a video and kind of break down the difference between the traditional medical model and the new medical model, right? So let's go ahead and we have traditional and then we have functional. So the traditional medical model, and I'm not anti-medication, I'm not anti-surgery, I'm not any of that. So there is a time and a place for it, but I think that as the science and the healthcare industry evolves, we need to evolve with it. And it's one of those things, there are a lot more chronic diseases than there should be. And why is that? A lot of it's education, because I talk to a lot of patients and they don't even know that you probably shouldn't eat wheat or dairy or any of these corn, soy. Why? Because, well, there are a lot of issues in the processing of those, and a lot of people can get it like diseases or develop symptoms from those. Okay, but that's for another story. So, traditional medical model is based on medicine and surgery, right? So this is their model. So if you want one of these things, so if you break your arm, right, or let's say that you have a tumor, or you have, you have an ulcer, you have one of these more severe types of issues, then this is the thing for you, right? You need to check that off. That's where you need to go. Medicine, same thing. If you have like a tumor, if you're already in a pathological state, if you have like a genetic condition, or you have just like an irreversible disease, right? Then it's like, yes, yeah, you need to do medication. If they can find what's called a pathology, perfect, then most of the time this is the correct place. Now, take that with a grain of salt, because the functional side can also help with this. Now, functional, what do? We're more oriented on lifestyle. So that's diet, that's nutrition, which goes into diet, but it's also supplementation. It goes into sleep. It goes into stress reduction. Okay. So this is most likely when the medical model, the traditional model, so you should always consult with them if you really have like a severe issue going on, right? But let's say I see this all the time, and that's why I wanted to make this video. You go and get labs at your traditional medical model, and they're like, nothing wrong, right? And you're like, but I feel bad, You're like, man, I've got this migraine, I've got these achy joints, I'm fatigued all the time. Maybe you're depressed, or maybe you got some sort of pain that you just can't figure out, right? And they're like, well, all the tests are normal, so it's probably just in your head, right? And then you start thinking, you're like, man, am I crazy? Like, is there nothing wrong with me? What's going on? And I think that drives people more mad than anything else, right? So now, when this happens, a lot of the times this is where my patients come from. Okay, so traditional medical models, like, nothing's wrong with you, and so you're thinking, well, there's got to be something, and then what it is, it's functional, because your biochemistry is vastly complex, and the way that you process neurotransmitters, hormones, and all these other different systems in your body, and how they have to work cohesively together to essentially give you the best and optimal function, is really complex. But that could be that you have poor diet, right? I see this a lot of the time. A lot of the times, let's take, for example, people are magnesium deficient. So they've got magnesium decrease. And why is that? Well, nobody eats green leafy vegetables, right? I mean, every time I ask somebody, maybe different patient demographics are different, but nobody's like, I'm not eating green leafy vegetables, like, ugh, right? So it's one of those things, well, maybe we need to do some magnesium supplementation if you're not going to eat green leafy vegetables. Because how magnesium works, and I'm going to nerd out here a little bit. So you have a muscle cell, and for this muscle cell to contract, calcium has to flow in, and that causes a muscle contraction. And then if you're magnesium deficient, what will happen is you won't be able to relax this muscle. So people that say that they're stiff, that they feel like they've got like really tight muscles, most of the time it's because they don't have magnesium. So calcium flows in, the muscle contracts, but you need magnesium to come in and bind onto the muscle cell to release this calcium. Okay? So what does that have to do with anything? Well, most people that are stiff or they just feel like they're really tight, most of the time it's because, one, you're not eating green leafy vegetables that have magnesium in them, and so you can't relax your muscles efficiently. So that's just from a functional standpoint, right? So if you're feeling a certain way, then most of the time it's due to one of these imbalances. And so you need somebody who can really help you with that and help you understand that. And that's why this video is here. So that's just a little bit of muscle physiology. And now let's say nutritional. Let's say that your B vitamins are down. B6 and B5 are probably the ones that I catch the most. But if you look at like neurotransmitter pathways, to make essentially B6 is needed for dopamine, it's needed for serotonin, it's needed for your sex hormones, it's needed for your thyroid hormones. And a lot of people aren't eating. So if you're not eating like an optimal diet, and I help people, why do I need a supplement? And well, if this isn't optimal, then you need to supplement, right? Because if you're not going to intake it, it's like not putting gas in your car. It can't run, right? So you have to find a way to get it back in the body. So a lot of the times it's like, oh, well, you feel sad? Well, probably because you don't have enough B6 because you're eating garbage to not make dopamine or serotonin. Oh, you have low libido? It's probably because you're eating crap and you don't have enough B6 to make your sex hormones. Oh, you're gaining weight or you're feeling sluggish? Well, probably because you're not eating enough or you're not supplementing, you don't have B6, can't make thyroid hormone, okay? So, that's like from the functional standpoint. I see a lot of people with thyroid issues, especially, or like low libido or depression, and it's like, and the medical model's like everything looks fine, but then they never check like B vitamins. You never see, okay, are you deficient? How's your diet? How's your water intake? How are all these other factors? Because they're trained on a different model, right? They're more like emergency care, in my eyes, is how I see them. There is family practitioner care, but I think that should almost transition more to here. It's like, let's coach you how to live appropriately so that you can do the things that you want, And I know this model isn't for everybody, but for those who want to optimize this is where we go, right? And then sleep. If you're not getting the appropriate amount of sleep, there's more research coming out on this that is huge because try not sleeping for 2 days and see how you feel. Right? So if you're not getting optimal sleep or you're not optimizing your sleep, this can go back to if you don't have appropriate amounts. So serotonin gets converted into melatonin, which makes sleep. So it's like poor diet. You don't have this, that's negated, that's negated, that's negated, and then your sleep is negated. Okay? Now, stress reduction. So a lot of people, you're just like go 100%. This is why I run cortisol rhythms on most people and see how their stress is doing. And then Okay, well, if you want to run like a Ferrari, we've got to fuel you like one. So let's do some supplementation. Let's do some dietary strategies. Balancing blood sugar is one of the biggest keys. And then what you need to go take some time, right? Well, how do you plan that into your day? Are you planning it appropriately? So that's kind of like the overall encompassing idea of the difference between a traditional medical model and a functional medicine model, and the times that are needed for both. And obviously, there's a symbiotic relationship between the two, right? It's like they're both needed, right? But I think we've just come to err on this side more, and I think we're seeing a lot more pathology for that reason. So I hope you like this video. Click the like button below, comment, let me know what you think. If you want me to talk about lifestyle or diet factors, this side isn't really me, but I understand it enough because I worked in it before I went to this model. So if you want me to cover more nutrition, more sleep, stress reduction, if you would like me to cover hormonal pathways a little bit more, neurotransmitter pathways, I'm more than happy to. And yeah, just shoot the questions below, and I hope you'll have a good day. See ya.